It's a very, very bad epidemic that's going on.
It kind of came in a wave, it hit hard.
And you wonder, is there an end in sight? Is there ever going to be a change? Is there ever going to be a fix to this?
One overdose death of a human being is too much.
Hi, good evening. Thanks everyone for joining us. I'm Fox 13 investigative reporter Taylor Stevens, joined by my colleagues Robin O'Guinye, John Franke, and Nate Carlisle. And together, the four of us have been reporting on the wide-ranging impacts that fentanyl has had on our state. We started working on this series a little bit earlier this year after I read a report from the state that said deaths from fentanyl had spiked 1,136% between 2014 and 2023. And I really wanted to understand what impact that has had and how deadly it has been, how communities have been responding. A reminder that we are taking questions on this series and we'll be answering some questions from viewers throughout this conversation. If you have those, you can throw them in the chat. In the meantime, I'm kind of curious to hear from everybody else that was part of this reporting. What were some of your major takeaways? Nate, what was your major takeaway as we worked on this series?
Yeah, Taylor, seizing pills is just one part of the equation. Law enforcement wants to prosecute anyone whose customers die. That's a specific policy of the Utah Fentanyl Task Force and something that sets it apart from, say, previous drug task forces.
I think for me, I think everyone needs to put aside whatever their feelings are about drug use in whatever form it is, whether it's for medical purposes or folks who use it recreationally, because the onus really is on the community to help combat this problem. And we'll get into that a little bit more later. But really, there are small ways we can all help. And there are numbers to show that when the community helps, we can put a stop to overdoses.
And for me, kind of to piggyback off what Robin just said, it was the human face that we're seeing to this. I think we get the tendency to live in our little bubbles and we don't think it's an issue that affects us or our communities. But what I learned from speaking to firefighters is that it's everywhere, and it can be your next door neighbor. It can be the person across the street. It can be the person you see, while you walk your dog. And it was also striking to me is so many people in Utah in our community, which I guess shouldn't surprise me, are willing to help. We saw that with the Salt Lake City Fire Department chat team. We saw that with the law enforcement officers working through DARE to make sure kids don't fall into that fentanyl trap. So yes, it's affecting a large portion of our community, but yes, there are a lot of members of our community working to solve this problem.
Yeah, I would say for me, one of the pieces of this that I was covering was deaths due to fentanyl. And I think just like the sheer number of deaths attributable to fentanyl over the last few years has really stuck out to me. Thousands of Americans dying from fentanyl overdoses every single year, hundreds of Utahns. And we spoke with one woman, Stacy Greenfield, whose husband died from a fentanyl drug that he took. It was an oxycodone pill that was laced with fentanyl. Here's what she had to say about her experience.
He went to the drug dealer's house, went in for 45 minutes, came back out, drove about 2 minutes down the road, pulled over, and he never left. That's where he was found dead. The one pill can kill, because it only takes one pill.
I think that when I started doing this reporting, I didn't realize how deadly, obviously we sometimes hear about fentanyl, but I didn't really understand why fentanyl was necessarily being added into drugs and illicit drugs. And one thing I found really interesting doing this reporting was that oftentimes fentanyl is being added not because drug users have demand for it, but because suppliers find it very cheap to add to drugs. It does not rely on a crop cycle to make fentanyl. It's made in a lab synthetically. And so, there's no growing season for it. It's very cheap to produce. It can create it can cost only about 1 cent per fentanyl pill for the cartel to make these, but they can sell these pills for $1, $5, in some cases even more. We saw some court documents on the Ute reservation where they were selling for $20 per fentanyl pill. So really high profit margin, cheap to make, easy to add. But sometimes because fentanyl is odorless and colorless, people don't know that it's been added to whatever it is that they're taking. And if you say have never taken opioids before, you could be very, very vulnerable to having a fatal overdose without even knowing that you're taking fentanyl. And we did get a question from Brittany in Orem, and she wanted to know what changes would make it easier for someone to ask for help before an overdose happens. And there isn't necessarily an easy answer to this, but one thing that a lot of advocates told us is that it's an obstacle to asking for help when there's a lot of stigma around drug use. And so they talked about reducing the stigma by having conversations like these, by, trying to make people feel comfortable knowing that if they come forward for help, they're not going to be judged, and that they can receive that help that they need. And so that was one thing that we heard in almost every single conversation that we did, was just how much stigma there is around drug use in the community.
Taylor, a lot of your reporting focused on communities that had been hit particularly hard by fentanyl. What we are about to listen to is a few different people from Carbon County just talking about what that's been like.
I think most everybody has friends or family that have had an overdose death. We all know people.
We've had a lot of loss. Those are people's loved ones, their families, their neighbors, their church members, right? Like, it's all connected.
Yeah, so I know there was a lot you were trying to understand by focusing on Carbon County. Taylor, what were those takeaways?
Yeah, I think that when you look at the state, there are some areas of our state that have been impacted by fentanyl and by drug addiction more than other parts of the state. And I did want to understand, why is that? Why has Carbon County in particular been hit so hard by drug addiction really since the opioid epidemic started in the early 2000s? And in talking with a lot of people in the community, and people were really excited to talk with us and really open and talking with us, because this is something that, like you heard, hits really close to home, that a lot of people are working on and trying to get to the bottom of. But there isn't just one reason why Carbon County has been hit harder than other parts of the state. It's kind of one of the people we talked to called it a perfect storm. So, some of the elements that contribute to this is there's a lot of people in Carbon County that work jobs that require a lot of hard physical labor. And people told us that sometimes they see drug addiction start with legitimate pain. Somebody has an accident, they have to keep working, they get a prescription for an opioid, and then once that prescription runs out, they have a chemical dependency on whatever opioid maybe they've been put on, and that leads to them seeking drugs on the illicit market. So that's a factor. We also saw that there was high levels of generational addiction. One of the women that we spoke to talked about, everybody in her family had been addicted to substances in some form, whether that be alcohol or drugs. And if you see other people in your life cope that way, then it can feel easy to, turn to substances as well. High levels of generational poverty and low levels of recreational activities. Obviously a lot of things to do outside, but maybe not as many activities as you have in some other parts of the state. And so that can lead to people partying, teens partying a little bit more, seeking out, trying to find ways to limit their boredom. Those were all things that people kind of pointed to. But, one thing that really stuck out to me going there was that the community has really been working together. We spoke with government, advocates, treatment providers, people kind of across all of these different spaces that were really working together and coming together to try and address addiction in the community. And ultimately, they have had a lot of loss in this part of the state and have seen a lot of people die from drug overdoses. And so it really hits close to home. And I think that's why you see so many people working together to try and address this issue. And Nate, you also spoke with a woman in a different part of the state in Cedar City who lost a family member to a fentanyl overdose. Let's hear from her what she had to say.
It really is a sickness that pulls you in. And if you let your guard down for a second, like Kylie did. So the fentanyl, took her like that.
Yeah, what makes Kylie's case unique from, say, past drug investigations in Utah is instead of treating Kylie's death just like an overdose, like a drug crime, basically, the police in Cedar City, with help from federal law enforcement, investigated this more like a homicide. They found camera footage of the drug drop. They tracked the suspect's movements. The two suspected dealers eventually pleaded guilty to federal drug charges. Again, it's a written goal of the Utah Fentanyl Task Force to pursue dealers when their customers die. Let's take another question now. Brittany and Orem also asked us this. Are arrests alone reducing fentanyl deaths, or do they need to be paired with treatment? Well, Brittany, in my experience, police are the first to say you need a treatment component. The Utah Fentanyl Task Force does pair with some health agencies. Also, in the task force's 2025 report, it recommends increasing funding to not just treatment providers, but also agencies doing harm reduction, such as needle exchanges. John, you spent some time with the Salt Lake City Fire Department and social workers who respond to a variety of issues, including overdose calls. Let's take a look at some of what you saw, John.
Okay, so this is a pretty common presentation. An individual that somebody called and said was having an overdose and gave Narcan. How many doses of Narcan did you guys give it? Our city, our police officers actually carry Narcan. And if they show up on a situation where someone's not acting right or normal, they can give Narcan before we even get there and potentially reverse that overdose. Right now, they're just doing a quick basic assessment. You can see she looks like she's nodding off. That's really common with overdose, especially of an opioid. She's actively resisting in some ways as well and not wanting to be physically manipulated. When you're in that overdose state, you're very confused and it's sometimes difficult to understand what's going on around you.
So that was part of my ride along with Salt Lake City Fire Department's chat team. And what the chat team is, it's a group of social workers assigned to 3 different stations in the department, and they assist firefighters and paramedics on certain emergency calls, much like that potential drug overdose. It was unclear what that woman may have been overdosing on. I want to make that clear, so we're not sure if it was fentanyl or another drug. But the idea is that the social workers have more expertise in certain areas that can get people help they need. The firefighters and paramedics, they do amazing jobs in that moment. The social workers are there really to kind of help, maybe follow that person to the hospital to get them help they need after they get out. They also carry, as they said, the Naloxone, the Narcan, and they told me that can reverse an effect of an overdose within seconds. In fact, one of the firefighters that we spoke to, or the paramedics, called it a miracle drug because it has such an amazing effect on somebody who is overdosing. They told me they get roughly 3 overdose calls each day. And we started with them first thing in the morning when their shift started. That was just the 3rd call that took us to North Temple for that woman who was apparently experiencing an overdose. So it's something that they see quite often here on the streets of Salt Lake City. But they believe it helps in many ways. It can help relieve some of the strain off of the 911 system. And it can also help, more importantly, direct people to the help they need if they choose to accept it. We were at one call where a woman was offered help to go to a shelter, a resource center, and she declined that, which happens as well. But they say if they can just save one life, then all their work is worth it. And as we heard from the Salt Lake City Fire Department, they do carry naloxone, the opioid overdose reversal drug. Robin, you and your reporting found that this works, and you even had someone in the Salt Lake Harm Reduction Project show you how it works. So tell us more about that. I think we have the soundbite first.
If we're dealing with nasal naloxone, this is going to enter through the mucous membrane. There can be issues with there being just a bit of mucus, so we recommend that people use the person's shirt to kind of wipe away any mucus. Then you're going to stick this up the person's nose and make sure that your hand is not on the plunger, because you only get one chance. If you do just a little bit, it's gonna go off, and you wanna make sure that it's all the way up in their nose before you are spraying. Then once you have it there and you're ready, you go ahead and spray. Then at that time, you're gonna set a timer for about 2 to 3 minutes. This is going to feel like forever. During this time, we recommend that you do rescue breathing. A lot of people think that you should do compressions. If the person has a pulse, there is no need to do compressions. Every 2 to 3 minutes, if they are not breathing, continue to administer naloxone.
Yeah, so in my story, I talked to Courtney, who was so lovely, and she experienced a lot of loss, has experienced a lot of loss due to overdoses from various drugs. It started with her dad, and then she lost her best friend, someone she had been friends with since she was 9 or 10, and then the father of her child, and then her baby itself also died of an overdose. And so while I was talking to her, one thing I was just thinking about was, if someone around had naloxone, Narcan at the time, you wonder how many people could have been saved, right? So someone in West Valley City, Alicia, thank you for this question. We got a few questions like this, wrote, where can I purchase or get Narcan or naloxone for free just to keep on hand? First, I'll say if you are up for buying it and you just want to make sure you have the right stuff, you can get it from basically any pharmacy, but it's going to run you about $50 to $200 depending. So that option is available. But if you are looking for it for free, it looks like this, by the way, if you can see. A lot of local libraries, a lot of libraries concentrated in the Salt Lake City area will have them. Basically, any of the big branch libraries in any of the cities or towns around here, they do keep it. You'll just have to ask them if you can have 1 or 2 doses to take with you. Many fire stations around our area as well will carry it, so that's always a good resource to have. One thing I do want to mention that I think is really cool is naloxone, even though it does have an expiration date on it, it's still good for about 10 years, even after its expiration date. So, if you grab a couple, keep one in your purse, one in your car, like I do now, you don't have to worry about replenishing it for a while, unless you use them. So once you grab a couple doses, you should be set. Also, the Salt Lake Harm Reduction Project, whom we just heard from, on their website, they have a map of areas and places in the state where you can find naloxone for free. So they are a great resource. And Narcan, naloxone, it falls under what we call harm reduction, basically anything to reduce behaviors that are linked to drug use, however that might look. Taylor looked at something a little bit different. She looked at fentanyl test strips. What'd you learn about these, Taylor?
Yeah, so we did interview one man, and I think let's hear from him, just kind of his experience using fentanyl test strips, and then we can talk a little bit about what they are and how they work.
I've actually been a witness. I've personally seen several overdoses. It's a fentanyl.
Were those fentanyl related
Mm-hmm.
overdoses?
Yes, ma'am. Yeah. We checked it afterwards. Sort of a retrospective what happened, and we used a test strip, and it was had a lot of fentanyl in it.
So, like we talked about a little bit earlier, one thing that is really scary about fentanyl is that it can be deadly in such small amounts. There's some research that shows that just the amount of few, like grains worth of sand, can be a lethal dose, especially if somebody does not have any tolerance for opioids. And so that's kind of where these fentanyl test strips can come in. The fentanyl test strips allow someone to check whether there is fentanyl in their drug supply. And it's a pretty low cost intervention. These cost about $1 each, but there is research that was done in the state. This was a pilot project before they decriminalized these fentanyl test strips. And the state found that when people had access to these test strips, when they were able to test their drugs, that they changed their behaviors as a result of getting a positive response. So they were less likely to use without someone there, kind of like what Robin was saying earlier with naloxone. If someone's there and has naloxone, they can reverse an overdose. They were more likely to use more slowly, more likely to not use the drug at all, to go back to the person that they bought it from and let them know, hey, this has fentanyl in it. And so, it's not clear exactly how many lives might have been saved as a result of these fentanyl test strips, but a lot of advocates really believe in them because they can provide people with more information before they are using a drug, and that can allow them to make different choices. One thing that's interesting with harm reduction tools is often they come under scrutiny or are sort of criticized by people who see them as enabling people to use drugs. And, naloxone is one that a lot of the community has really come around on. You don't really hear as much concern about naloxone, but I would say the fentanyl test strips are one that seem to be a little bit more controversial. The federal government recently cracked down on spending federal dollars on fentanyl test strips. So typically the state of Utah has the Department of Health and Human Services and their Office of Prevention has spent money to buy these fentanyl test strips, which they then kind of distribute to local health departments, to harm reduction groups, so they can get them out into the community. And now they're not able to spend those federal dollars on that anymore. Their office is primarily funded with federal dollars. And so they told me back in June that they had about a 6-month supply of fentanyl test strips. And once that ran out, it would kind of be up to these individual harm reduction groups to find other ways to fund them. We did get one question from Marcy in Syracuse about these fentanyl test strips. She said, I heard that you can get free fentanyl testing kits. Does one need to test medication one gets from the pharmacy? And just to make it clear, if you're getting prescription medications from a licensed pharmacy, experts have told us that there is no need to test those since state and federal laws regulate those pharmacies pretty strictly. Instead, test strips should be used for any drugs that you might obtain from street dealers, or if you're buying from a sketchy pharmacy online that you don't know if it is licensed or kind of how it's regulated. Any of those, these fentanyl test strips can be, life-saving for people, given that we know that fentanyl can be deadly in such small amounts. And, a lot of attention has gone toward harm reduction, but experts say that it's also really important to be focused on prevention efforts or ensuring that people never become addicted to drugs in the first place. And John, didn't you went out to a training that DARE officers held recently to learn more about how to talk to kids about fentanyl, right?
I did. I believe we have a quick soundbite here to play from one of the police officers that we spoke to.
When you're faced with some of the hard choices, because you're going to get that in life, that you guys have the tools that you need to make a good choice when those hard choices come up. Like if somebody does offer you drugs, or if somebody asks you to share an image on social media.
So that was a deputy from the Wasatch County Sheriff's Office who was speaking to a group of homeschooled children in Davis County. And that deputy was completing the 2-week training that DARE officers go through before they take those lessons into the classroom. And those were all law enforcement who also work as school resource officers in various parts of the state. We saw deputies and law enforcement from Wasatch County, Cedar City, Riverton, Bluffdale. So all over the state, urban, suburban, and rural. And I'm sure a lot of the folks watching us right now, if you grew up in the 80s, 90s, 2000s, you probably had a DARE class sometime during your education. What I was told and what I saw is it has evolved through the years. I think back in the early days, we all heard the Just Say No campaign. It has definitely evolved from that. And it's so much not focusing just solely on drugs anymore, but decision making and, starting kids off as young as kindergarten, how to make those good decisions, not just in terms of drugs, but, for the younger kids, if the stranger danger or dangers online with social media and people may be asking you to do something bad, and having that trust, which was another big focus of the DARE training, was developing that trust between children and law enforcement, making those connections positive at a young age so they can trust law enforcement, as they grow up, as they become teenagers and young adults. I spoke to a parent out at that training session, which took place last Thursday. And she told me, when I asked her, these are tough conversations to have with kids. Are you happy that these officers are addressing them? And she says, well, actually, they shouldn't be tough conversations. And in her household, they're not tough conversations because they're so important. Her main takeaway was it's another mentor who is reinforcing what we are teaching our kids at home, and a second voice really kind of giving that message to kids on how to make those good decisions to stay away from things like drugs. And my final point on this is we spoke to an officer who was out from California because it was a regional training for the entire West. She works with middle schoolers, and we asked her, if fentanyl is an issue in the middle schools. And she says, not yet. It's not an issue with the middle school students, but there is so much information out there. They're on their screens so much all day. They know about fentanyl and they do have questions. And so some of the training the officers receive helps them answer those questions to those kids who might come across it. If you're in middle school, you're 12, 13 years old, they might come across it in 2, 3, 4 years. So they want to make sure that they're answering those questions properly when the kids ask them, because we know the kids are exposed to so much and they do have so many questions.
Yeah, I'm seeing a question in the chat from Brittany on Facebook, and she asked, if you could change one thing about Utah's response to fentanyl tomorrow, what would it be and why? And as you were talking, John, I was thinking that's something that came up a lot in my conversations with people about fentanyl. Is sometimes we get really focused as a community on, being very responsive to people that are addicted to drugs right now. How can we help keep them alive? These are very important questions. Harm reduction is very focused on that issue of how do we help people that are struggling right now? But everybody that I talk to says, prevention can be harder to measure, because how do you know that your prevention efforts kept, someone from getting addicted to drugs or helped them, never kind of go down that path? But I think in so many things in our state and so many complex issues, we end up putting out a lot of fires rather than focusing those dollars on prevention efforts before these problems become, a bigger issue. And so it seems like that DARE program that you went is one of those ways that we are trying to focus on prevention. Do you think that's accurate?
I do, and I'll take that a step further with my first story in the series, which was the chat team with Salt Lake City Fire Department. You mentioned that, a lot of the response is putting out the fires and getting the Narcan to the person who may be having an overdose to help them in that moment. But what happens to them after that? Is it going to continue to be a cycle? And I think what that chat program does so well is they do follow up with the patients, the victims of these drug overdoses, to see how they're doing. They offer them help to kind of break that cycle of addiction. And what's I didn't mention earlier is that chat program is only in 1% of fire departments across the country. It is because it's very expensive. Obviously, they are employing nearly a dozen social workers to go along with their firefighters and their paramedics. So it is a very costly program, but it's an investment. Really. It's not just helping people out in that moment, which is critical. It's helping them out afterwards, following up. I think that's the biggest takeaway that I received from that chat program.
And Taylor, we should point out too, there is some evidence of success. Deaths have declined in Utah over the last 2 years. So That's something actually the task force is touting, both in terms of, not just arrests made and pills seized, but how many people have actually died. And they take lower number of deaths as some metric of success.
Yeah, and I think, when I spoke with the Department of Health and Human Services, they also mentioned their education efforts. And again, that prevention focus on helping people understand how deadly fentanyl is, testing drugs, not taking anything that you don't know where it has come from that hasn't been prescribed to you at a pharmacy. And so, there are signs that all of these things are effective. I think a lot of people would say we need to put more emphasis and focus on prevention, but definitely signs that these things are working. I think as we wrap up here, we'll give, just another minute if anybody has any last questions that they want to ask. And maybe, if there's anything that we didn't have a chance to talk about that any of you would like to mention as we kind of wrap up here.
I think one thing I would want to reiterate, just kind of piggybacking off of what you just said, Taylor, because when I spoke to the folks at Harm Reduction, they said, both of the people I interviewed said a lot of times they will offer people when they're doing outreach events, Narcan, Naloxone, and people will say, oh, I don't do drugs. And the thing is, you can't Naloxone yourself, right? So I just want everyone to remember when it's offered to you, it's not about you, right? It's really about taking care of the person who it could be. And I mean, you just never know what can happen, where you'll be, whether it's a concert or out at the park or any place where someone could have the potential to overdose, right? It's just good to keep that in mind. If it's offered to you, take it because it's not going to be used for you.
Yeah, you never know. Anything on your mind, Nate? Anything we haven't talked about?
Well, I don't think anyone has a vision of Utah arresting their way out of the fentanyl crisis. But for those that are arrested, I mean, there's penalties here. The two drug dealers I talked about that pleaded guilty to federal charges, one got sentenced to 12 years in prison, the other one to 15 years in prison. I mean, there's just bad economics here on the dealer side if they do get caught.
John, any final thoughts?
Yeah, I just think, removing the stigma is so big. And I go back to something that Division Chief Kyle Lavender told me was these are good people that are falling into this, and they don't deserve to be stigmatized. And I think when we realize that, I think that's when we can really start to help people. These are good people who we are losing, unfortunately. And the good thing is that we are seeing so many people like Division Chief Lavender who are investing so much time and resources into trying to fix this problem, because, as he's mentioned to me, he had a neighbor who fell into fentanyl addiction. And I think we're all so touched by it. We just need to kind of end that stigma and realize these are people's brothers, sisters, sons, daughters, parents. These are good people who we're losing, unfortunately.
Yeah, I think just to kind of reiterate, John, your interview with the fire chief, he talked about seeing, I think, like moms and dads and people that, I think sometimes people have this idea of what does it look like to get addicted to drugs. And I think what all of us have seen in this series as we've been reporting on these issues is that it really can happen to anyone and that it's not necessarily a moral failing. I think often in our society and in our community, we see it that way, or we act like it is that way. And, like I was talking about in Carbon County, there's so many people who started with legitimate prescriptions and then from there got addicted, had a chemical dependency that your body has that you are trying to address, and in some cases can even be life-threatening if you don't get some of those chemicals in your body. And so I think that was one thing that really stuck out to me, was that this really can happen to anyone, and reducing that stigma and understanding that this is something that we all need to address together. I think we saw a lot in our reporting, so I think that's maybe a good place to end. And I appreciate all of you guys, joining us for this conversation. And, we'll continue reporting on these issues. If there are other stories that you'd like to see us cover, whether it's about fentanyl or other topics impacting Utah that you think deserve a deep dive, you can email us at iteam@fox13now.com. That's ITEAM at fox13now.com. And thanks everybody for joining us.